the second of the two-part series on chronic pancreatitis. In the previous video, we discussed causes of chronic pancreatitis. What is chronic pancreatitis? What are the symptoms and what are the complications? In this, we will focus on the diagnosis and treatment of chronic pancreatitis. Just as a recap, here is a cartoon of the inside of the abdomen. The pancreas is at the back of the stomach. It has two main functions. It produces enzymes which go down this tube over here and meet with the food coming down from the stomach into the small bowel to digest that. It also produces insulin, which brings the blood sugar levels down and prevents diabetes. Now, there are three features distinct to chronic pancreatitis. Firstly is inflammation, and the second is calcification. So there are calcium deposits throughout the pancreas in chronic pancreatitis in general. And lastly, fibrosis. And fibrosis means that the pancreas has more scar tissue than normal, to the point where the whole of the pancreas may shrink down. Rarely, it could incorporate the bile tube, causing obstruction in the bile tube or obstruction in the early small bowel. Patients with chronic pancreatitis are also prone to complications, such as formation of a pseudocyst, bleeding, obstruction due to fibrosis, and a high risk of cancer. So how do we diagnose chronic pancreatitis? And obviously, the first is symptoms. As the pancreas is unable to produce the enzymes to break the food down, patients may get diarrhea or steatorrhea with a lot of fat in the stool, and the stool is pale, offensive, and tends to float. Patients may become diabetic. They may have nutritional issues. There may also be symptoms secondary to the complications, such as formation of the pseudocyst or fibrosis. Once pancreatitis is suspected, then this would trigger imaging. This means scans. The commonest scans performed to diagnose pancreatitis or chronic pancreatitis is a CT scan or an MRI scan. And these would look at the pancreas very carefully, trying to find the features that I described before of inflammation, calcification, and fibrosis. The scans would also determine the integrity of the pancreas tube and whether or not there is a tumor or a cancer, or whether there is a stone in the main pancreatic tube. In the great majority of the patients, these scans usually are sufficient to diagnose chronic pancreatitis. In a small minority, or to gain more understanding of the pancreatitis, chronic pancreatitis and its complications, an endoscopy is sometimes performed called endoscopic ultrasound. It means passing an endoscope with an ultrasound scanner attached to it, which parks itself right next to the pancreas by going through the gullet and the stomach. And the ultrasound scanner becomes active and takes very close pictures of the pancreas. Both the head of the pancreas as well as the body and the tail of the pancreas can be viewed very clearly, and if needed, biopsies are taken. It is rare, but in some instances, pancreatic function tests are performed in specialist unit to determine whether or not the pancreas has lost its function of producing enzyme and whether a patient is either diabetic or may become diabetic soon. Okay, so now let's focus on the treatment of chronic pancreatitis. So the first port of call is to treat the cause of the pancreatitis. Now, I discussed these in the first video, but the commonest cause is alcohol. So giving up alcohol certainly would improve the outlook for chronic pancreatitis in patients. Smoking is another big risk factor. Then there are causes that may cause acute relapsing acute pancreatitis, and there is a large number of causes for that. And doctors would certainly try to understand why someone has developed chronic pancreatitis and whether there is an acute relapsing element to it, and try and treat that. Wherever possible, patients with chronic pancreatitis ought to be referred to specialist units. In such units, the patients tend to get holistic care that doesn't just focus on one aspect of the treatment. First and foremost, the most important component is to treat the pain effectively, because pain is a major problem with chronic pancreatitis. Before we start treatment for pain in chronic pancreatitis, we need to make sure that the patient doesn't suffer with other conditions which are common alongside pancreatitis, such as a gastric ulcer or gastritis or reflux, gallstones, cardiac conditions, and so on, which may be mistaken with pain secondary to chronic pancreatitis. That said, the pain is the most difficult feature. The attempt should be to use simple analgesics, and if opioids are required, that this should be a considered, graded decision between the physician and the patient. Sometimes the pain is so severe that this merits further treatment in specialist units, and these could be endoscopic treatments, such as destroying the pain fibers over here next to the pancreas in what is called a celiac axis block. So what you do is, as I described before, you do an endoscopic ultrasound, park it over here, and then inject chemicals that destroy the pain nerve fibers next to a major blood vessel that try and control pain in chronic pancreatitis. Lastly, in some patients, surgery may offer a good hope of controlling pain and dealing with the complications at the same time. Surgery for chronic pancreatitis is a highly specialist area, and it is outside the scope of this talk to discuss this in more detail, but it is important that only surgeons with a specific interest in this condition undertake such surgery. So after pain, patients ought to focus on nutrition, because the great majority of patients with chronic pancreatitis will suffer with nutritional deficiency. Towards that end, because the pancreas is unable to produce enough enzymes, patients would be given oral enzyme supplements. These must be taken in the dose prescribed and along with any meal or snack that the patients may take. Patients will also need replacement of fat-soluble vitamins such as vitamin A, D, E, and vitamin K. There is some evidence that there is a beneficial effect of antioxidants in reducing pain in chronic pancreatitis. Now, surprisingly, starting the oral enzyme supplements sometimes also helps with controlling or reducing the amount of pain that the patient suffers. And lastly, but by no means less important, is the diet. So it is important that there is an adequate caloric intake that is relatively low in fat, and patients may find that they have to take multiple small meals. After pain and nutrition, it's important that the patients are screened for diabetes and that the diabetes is treated in its own right and according to the circumstances of the patient. Complications of chronic pancreatitis, and that patients are regularly screened when they develop new symptoms for these complications so that these are dealt with. And these include, as previously discussed, pseudocyst, bleeding, fibrosis causing biliary or small bowel obstruction, and risk of cancer. I hope you found this of use. If there are any comments, please do share.